Hi.
Hello. Hi. Can you hear me?
Hi. Yes, I can.
Awesome.
How
How
are
are
you?
you?
Good, good. How are you doing?
Good.
Good. Hi, JJ, and everybody watching. I
All
guess we can
right.
wait a few minutes for some more
Sure.
people to join, and then we'll get started.
Okay. Sounds good. How have you been doing during this time?
Pretty good. Trying to stay positive, stay in a good headspace. It's so easy to get kind of wrapped up and been stuck in the house. So trying to stay, you know, in a good space and not just get so caught up in that and teleworking and everything. How about you?
Yeah. It's been pretty much the same. Every day is a new kind of day. Some days are easier
Right.
than others, but just getting used
Hmm.
to things and just all the differences. But it's been pretty
Right.
good.
Yes. I definitely understand. Hopefully soon this will all be over. We can go back to, I guess it won't be exactly normal, but
Mhm. Yeah. It's
kind of
definitely
back to our regular scheduled programming.
Yeah, it's definitely gonna be different, but I look forward to that too.
Yes. Okay. I'm gonna pin this at the bottom really fast and then we can get started.
Okay.
Okay. So I want
Mhm.
to introduce myself. Hello, everyone. My name is Seisha. I am a community outreach specialist in the community health department at Whitman-Walker. My pronouns are she, her, and hers. Dr. Ellis, you want to introduce yourself?
Sure. Hi, I'm Dr. Ellis. I'm a family medicine doctor at Women-Walker Health. My pronouns are she, hers, and hers.
Awesome. Thank you for being with us
Of course.
today for
Mhm.
our Women Wednesday series. So, during the past few months, Women Walker's Community Health Department has expanded its outreach efforts to the social media platform. So, we're
Mhm.
covering various topics about HIV, STI, sexual health practices, access to care, social determinants of health, and general public health interventions. So, for the next few weeks, everybody join us every Wednesday on Instagram Live for our Women Wednesday series where we will discuss all things women's health, prep for women, sexual health, disparities, and access. And the community health team is here to support and educate you all.
Mhm.
So we kind of discussed this already, but
Mhm.
how are you adjusting to the new normal, Doctor?
Yeah. So, every day is a new day. Some days are better than others, but making a lot of adjustments, getting used to being inside and just getting used to connecting with people in a different way. But it's been good. Definitely, I can't complain.
What are some things you're doing to kind of cope with everything?
Mhm. So what I found to be really helpful for me is I make a weekly schedule.
Mm-hmm.
So I add in things that I can do just for fun. So for instance, like Monday playing Uno.
Oh.
Yeah, like coloring, just finding time to read, just really trying my best to keep my mind focused on just
Mhm.
knowing that this will pass
Right.
and trying to stay positive in the meantime.
Awesome. That's
Mhm.
definitely great coping mechanisms. I
Mhm.
need to try the Uno. I haven't tried Uno
Yeah.
yet, but I need to
It's
try
fun.
that.
Yeah.
And everybody in the comments, type some things that you're doing to kind of cope and to deal with the new normal. How are you dealing with it? What are you doing? Are you going exercising? Are you jogging? Are you
Mhm.
playing cards like Dr. Ellis? What are you
Mhm.
doing? As for me, I've been doing some reading, also researching things that I'm interested in.
Mhm.
Such I've been into like plants and essential oils lately, so I've been doing
Okay.
some research on that.
Yeah.
Um, that's something I've been learning a lot. So I'm thankful for COVID-19 for the sense of it's allowed me to take some time to focus on the things that I'm interested in too. So, because we're always so busy going back and forth, doing things that we don't take time to actually stop and focus on what we like to do sometimes. So that's the good thing. We have somebody said they've been jumping on their trampoline. I love that. Cooking, yes, that's something I've been doing too, trying to anyway. So okay, so today's topic, is a part of our Women Wednesday series, is PrEP for women and COVID-19 disparities. If you don't know what PrEP is, PrEP stands for pre-exposure prophylaxis, and it's a medication that you can take daily to prevent you from contracting HIV from an exposure. So if you're interested in PrEP, I have pinned at the bottom in the comments. It has our resource number and also how to contact us if you're interested in starting on PrEP at Whitman-Walker. Okay, so we'll get into our topic. Thank you for being here again, Dr. Ellis. As you know, the media and research shows that COVID-19 is disproportionately affecting our communities, our marginalized communities such as LGBTQ community, Black community, and Brown communities. From your perspective, I'd like to ask, what is different with us? Why are we being disproportionately affected? But first, could you tell us a little bit about what health disparities are?
Yeah, I think this is a great question. I'm really happy that you reached out to me to kind of shed some light on this and to start this conversation, because it's something that's been on the news a lot lately.
Right.
And when you hear the definitions, what they say is like, well, there are differences in health outcomes between different groups. You know, they'll put up charts and graphs, but the thing is, when you really think about it outside of the box, what you need to know is that these differences in outcomes are a result of the things that we decided are important with our society, right? So when society decided to pick the winners and losers, we make the determination who gets access to certain things and who does not. So I think about it like when you pick a group of people that are valued more than others, the others are treated differently, right? So when you think about certain neighborhoods that may have more resources than others, then our neighbors who have less have to fend for themselves with less, right? When you think about people who are working hard out there, several jobs, and you have clinics that are open 9 to 5, you have to think about how can that person get that quality health that they need to be healthy when they can't really be seen during those hours, right? And they may have to go to the emergency room and not get the kind of quality primary care that they need. So anytime you have a system like healthcare, any resource, and you try to restrict access to people because there are certain people with means, you put fees on things, basically our neighbors suffer. And that's really what you're seeing. And you're seeing that, you know, we are in a society, unfortunately, that has these differences that are kind of built in. When you think about certain jobs that people get, they're getting these jobs sometimes because of who they know, not necessarily what they know. They are, there are kids out there, unfortunately, in schools that aren't really giving them the full quality education. And unfortunately, they're on their way. The pipeline to prison is something we hear about a lot, unfortunately. And then we have neighborhoods that are built in a way that's not healthy. They don't have outdoor spaces. They don't have food access. So all of this is why, unfortunately, we have these disparities that we're seeing in regards to healthcare, but it exists in a lot of other parts of our society. And unfortunately, these are things that we've created.
Thank you for that. So going to my next question that I had, so why us with COVID-19? Like, what is it that's different with Black and Brown communities and the LGBT community? What is it that's making this such an issue for our communities in particular?
Yeah, and I think that that's a question a lot of people are asking. And quite honestly, I don't think anything is different. I just think that at this moment, we're talking about the coronavirus every day. So we're seeing this on TV. It's making headlines. The communities that have been affected by health disparities, they're not surprised by this. You know,
Right.
it's not anything new. And the thing about this virus, you know, it doesn't see the color of your skin. It doesn't see who you love. It doesn't see how much money you have, right? But then
Right.
we look at the statistics and we're seeing differences with the death rate. So when we think about it and you take a step back, first thing you see that people who need to work are working. The working class people need to work, right? So they're out there. They're considered, now we're calling them essential workers. They've always been essential, but now they're getting this title, and I don't think we truly value them for what they were doing throughout this time before coronavirus.
Exactly.
And then if you're working class and you're in the grocery stores, you're in the meat packing factories, like that's something in the news now, you can't do that from home. You can't do that from online. So unfortunately, these communities, they have to continue being out there, potentially getting exposed. And oftentimes, those are the same communities that have these pre-existing conditions that we hear about. So diabetes, high blood pressure, obesity. So it's kind of a compound effect. They have to be out. They have to be working. They're unable to social distance with the recommendations. And these communities also have pre-existing conditions.
Right.
So it's unfortunate. It's extremely unfortunate this is the way in which we're discussing it now, because these communities have always kind of had to deal with that particular balance.
Right. I mean, that's something that I noticed too. Like now is everybody's so aware of it, but this has been a problem. This has been an issue that we've dealt with for years and years. So, I mean, thankfully, Corona has brought that to or COVID-19 has brought that to the light, I guess you can say. But I don't think nothing has really, in my opinion, I don't believe nothing has changed. So,
yeah. I mean, the thing is, I really do hope that this will be the spark where we realize these are the differences that we have created, and we'll take a step to make that change. And I think we all play a role with that. It's not just waiting for it to happen. I think we all have a part to play with making these differences go away, to bring more equity to the table, because we're realizing now, when you're going out to the grocery stores, you're realizing, well, if this person isn't here, how am I going to get my food, right? And their value is much more than that.
Right.
So I'm glad that we're talking about it.
Yes, me too. So also, I just want to say to everybody watching, if you have any questions, feel free to drop them below in the comments so we can answer those for you. My next question, Dr. Ellis, is what do you think could be done to try to mitigate these disparities that we have on at a systemic level?
Right. So I think right now, on the greater scale, what we're seeing in the news and a lot of stories about are people who are the front lines, and they're, you know, stocking the groceries, they're in factories, they're in the hospitals, and they may not be, you know, the CEO, but they're there and they're providing essential services. And I think we need to make sure that we are protecting them based on the CDC preventive measures that have been listed. Unfortunately, we're seeing that this may not be followed in instances, and I think it's important for us to stand up and voice that concern, because we should be following that for our population who's out there in the front lines every day. And then the other thing that you mentioned is, like, you don't see changes, and I just encourage you to just push that a little bit, you know, with the work that you do, putting a voice out there and connecting. I think it's important for us to realize our power. So once things are more normal, once you're back into some semblance of how it was, I think it's important for us to realize there are things that we can do. So if you go to a local church, you can start a health club. You can go to a community that does not have a lot of access to food and try to help build something there, where you have like a co-op, you know, partnering with people, start a local garden. I mean, it's the little things that ultimately will make a difference. So I think that we do have an ability to make a difference. And the most important thing to me really is just, like, we need to realize that this is human behavior, right? And we need to find ways to figure out why we do it so that we can make a change. So if you think about before, when people were going on the planes, you buy your ticket, you're getting excited, you're sitting there in the boarding, you're waiting for your row to be called, and then you have first class, you have supreme class, jewel class, you have all these classes, and then you look at your ticket and you're just like basic class, and it's just like, it just doesn't like really make sense to me, why we find a need to have all these divisions.
Right.
So I hope going forward, we will see that we don't need that, and we'll take a step forward in a different direction.
Right. And this kind of goes back to what we were talking about earlier as far as why are certain communities being disproportionately affected. This is just a question that I personally had. Do you believe that basically the disproportionate rates of COVID-19 in those communities, do you believe that that's related to the disproportionate rates of chronic diseases in those communities?
So they're finding correlations between communities that have higher risk for pre-existing conditions, so things that happened pre-COVID, right? And their ability to, once if they're infected, to then recover. So yes, they're finding that correlation to be quite strong, and that's why we need, for those who have chronic conditions, to make sure, one, that they're diagnosed, right, and then two, to make sure they're managed. And as a primary care doctor, my job is to try to prevent that from even happening in the first place.
Right.
There's a lot of prevention that we can do to prevent these chronic diseases from even being diagnosed in the first place. So that's something that I strongly believe in primary care's role to help with that.
Okay. I was wondering that, so I'm glad you could answer that for me. Thank you. Yeah. So my next question is, as far as at a consumer level, what would you advise that we do to keep ourselves safe during the pandemic, despite the health disparities that we're faced with?
So not even just during this time, but I think in general, on a consumer level, the most important thing is to realize that you have power, right? So you know how it feels when someone does not respect you or someone doesn't value you. You know that feeling. Like you've been in those situations where you feel like, something isn't right here. And I think we owe it to ourselves to recognize our power and say, I will not spend my time or my money in this place. I will not allow myself to support whatever the industry is who don't give me the respect and see my value. So that's the most important thing. And outside of coronavirus, that is very important. Like as a doctor, if I'm not doing what I need to do and you don't feel valued, you should fire me, right? Oftentimes people feel like, oh, you're the doctor. No. If I'm not doing what I should do because I'm here to serve you, I need to be fired. So oftentimes I feel like we underestimate our power, and a lot of these industries can't actually function if they don't have consumers. So we need to realize that. But as far as staying safe during this time, we need to check in with ourselves, right? We were talking about that at the beginning, just mentally and physically. This is different. We have never been through this before. No one has ever experienced this in our lifetime. So you need to get rest. Get that quality sleep. We need to keep stress down the best you can, right? That's very, very important. The people who have chronic diseases, who may not be able to see their doctors regularly, during this time, it's a bit different. You can't go to the office and get your blood pressure checked. These are the patients that, one, should continue taking their medicine, but two, need to also think about self-management. Right? If you have something like high blood pressure, so you have a blood pressure cuff in your house. If you have diabetes, you have a glucometer. And these are things that we can help with. There are a lot of opportunities to have that self-management. So we're doing telemedicine every single day. So we can be there with you and walk you through it and tell you what numbers are your goals, what you can anticipate and expect, and get you to those levels. Especially now, like you said, we're in our house, right? So we can help those things you may not have had time for in the past. We can help you get there and get under control. So I would say those are some really, really important things. And also just following the guidelines, right? So they're telling us physical distancing, they use social distancing. So you don't want to go in a place where you anticipate a large crowd, right? That's where the virus has an ability to go from person to person, right? So you're going to wear your mask, you're going to wash your hands, and you just want to make sure that you're following those guidelines. You're going to wash your face. And a few more things I want to say, and I think is really important, is now that we're home, you got to find time to work out. You know, you got to find time to fit in that workout. You may not have time for it before, and you may not have the routine down, but, you know, get up in the morning, try to get some steps in, find that routine on YouTube, do whatever you need to do, but now's the time to really focus on that self-care.
I love that.
Yeah.
That was something for me, because I haven't worked out at all this week. I normally go walking and do these workouts with my fiance. I have been in the house this week, so that was for me.
Yeah. You know, it doesn't have to be anything, you know, crazy. Like, you could just go to YouTube, get a Zumba video, have a good time. You know, you could even do Zoom workouts with your friends, you know, check in on each other, do a workout. We are allowed out, you know, you are allowed outside. You can take a walk. Just take proper precautions. So definitely don't neglect yourself in that way. And the most important thing is during this time to be safe. Emergencies are still emergencies, right? So if you're having chest pain, you're having shortness of breath, you're having weakness, you're having numbness, signs of stroke, anything like that, don't sit in your house and think about what to do. I understand people are afraid. They don't want to go and possibly expose themselves in a hospital, but those are emergencies. Emergencies before COVID are emergencies now. So if you're feeling any of those things, you need to call 911 and you need to get help. Don't sit and think, oh, this is not an emergency. Whatever was an emergency before is an emergency now. So that's very important. And if you are having symptoms that are the things that we hear about for COVID, shortness of breath, cough, fever, any of those things, and you're not sure what to do, you can give us a call. We are here. We are working. We will welcome your call. We'll talk to you. We'll try to help you figure out what to do. You can call the main line and get more information about that.
So that goes into my next question. I was going to ask, what are Whitman-Walker health doctors doing to support clients and patients during this time?
Yeah, so I would say, like, I'm relatively new to the family. I started back in about October, and I really believe in this time, throughout the time I've been working, but definitely during this time, we work with our mission first. And our mission is that we see you. And, you know, when you see someone, when you can say to someone you see them, you understand them, you value them, right? And from the beginning of this, I believe that we were so focused on trying to find ways to help the community in any way and support the community in any way that we can find during this time, because a lot has changed. So what we're doing now, we have our centers are open for people who are experiencing symptoms of coronavirus, right? We're doing testing. We have access in Anacostia and also at the 14th Street site. And you can call. The number is 202-745-7000, and you can talk to someone about how you're feeling and how to get tested. And in addition to that, we also have telemedicine, right? So you can have a regular routine appointment, believe it or not, just like this. You can see my face, we'll talk. Whatever the case is, you can get some assistance, right? We're here to serve you, we see you, and the thing about it is we are committed to who we serve. A large percentage of the people who we serve are people from communities who have been historically overlooked. That is our commitment, and we continue to be focused on providing that access. So we are definitely here.
Thank you so much for that. Do you have any final recommendations or thoughts for the community?
Sure. So I would say that before this talk, I actually had about an hour and a half conversation with my little sister.
Mm-hmm.
I think she's watching right now. And I would say that during this time it's not easy. It's not there's a lot going on. You know, there's a lot going on, whether it be the fear, whether it be what you're going through, you know, emotionally, the differences with how just day to day, you know, we're not in our normal routine. So it's very important to connect to those people around you. Even if we can't do it physically, we can call. We have all these new ways of connecting, right?
Yes.
It's important to reach out, and I really encourage everyone today to reach out to someone and try to do it every day that you love and would love to hear from you, and really ask them, how are you? I want to know how you're doing. How do you feel? Like, I understand what you're going through. We're in this together, and we will get through it together. Like, that is so important.
Yes.
And
Connected.
you know, you have to stay connected, because we're social beings. That has not changed because of this virus, and I think we could continue to make that connection even stronger, because it is a time where we're all going through the same thing.
Right.
We can honestly say, like, I know what you're going through.
Yes, I relate. I can relate. It really
exactly. Exactly. Yeah. So that would be my advice, and I would just say, reach out to us. We're here for you. We understand it is a difficult time, but please, 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 if you need any, just even if you want to have a conversation about how you feel, you can give us a call and we can arrange to have that conversation.
Awesome. Thank you so much for that. I just want to say thank you for joining us on the live today.
Yeah.
You gave us some valuable information. I'm just thankful that I was able to have this conversation with you today and everybody's here. Let's see what some of these comments say. Somebody said keeping a list of people to stay in touch with is a great idea. I'm calling my sisters. They keep me feeling loved and safe. Yes.
Yeah.
Definitely agree. So, I just want to reiterate, feel free if you ever need to call our resource line for any, we have a resource line that you can reach out to and contact us if you have questions about COVID-19, questions about PrEP, or any Whitman-Walker services. That number is 202-797-4439. And stay updated on our website with the up-to-date information, whitmanwalker.org. Some of this information is pinned at the bottom. We also are offering PEP, emergency PEP for patients or people who feel they need PEP. You can give us a call also at the resource line number to get connected with that. And make sure you continue to follow us on Instagram, Facebook, and Twitter. We'll be doing these lives weekly, so please stay tuned for more lives, because we have one coming up tomorrow as well. We're giving out very valuable information, so please stay tuned. Thank you so much, Dr. Ellis.
Yes, you're welcome.
Really appreciate you joining. Okay.
Right, have a good night.
You too. Good night. Good night, everyone.